When you're diagnosed with cancer, it's unbelievably overwhelming. It's an evil disease that sneaks up on you and spreads silently. Suddenly, you're thrown into a world of big decisions, scary side effects, huge costs, gambling with life. To make it worse, traditional Western medicine may make you feel like you're stuck between a rock and a hard place, like your only options are chemotherapy, radiation, or surgery. But most patients don't even realize there are effective, holistic alternatives to treating cancer. And for the vast majority of people, it's not too late or too expensive. In this video, I want to share with you what I've told hundreds of patients who came to us looking for something different. I'll tell you about what holistic alternative cancer treatment options you have here, and how these alternative cancer treatments compare to conventional treatments. To start, let's talk about the alternative cancer treatment options you have. Yes, you have options. It's hard to think straight when people are telling you you have to act right now. Some patients may have already started on the mainstream route, and after months of treatment, their energy is totally drained, hair falling out. They have mountains of medical bills, and they're told there's nothing more we can do. Others haven't begun treatment because they are just recently diagnosed and are in early cancer stages by the time they get in touch with us, but the clock is still ticking. If any of that sounds like you or someone you love, hang on. Because many people do turn the corner and see the light at the end of the tunnel in just 2 to 3 months, thanks to our huge arsenal of holistic treatments. These holistic and alternative treatments are non-toxic, often much more targeted, and in many cases not as expensive as you might think. We have an extensive list of over 35 different alternative cancer treatments. About half of them are so effective that they are considered to be potentially curative, and the others are considered helper therapies. I want to give you some of the main treatments so you get a sense of what we do. A common treatment is high-dose intravenous vitamin C. It's a simple but powerful treatment that is listed on the cancer.gov website and is supported by studies from the National Cancer Institute. To qualifying patients, we offer doses of up to 100 grams of intravenous vitamin C to weaken cancer cells without harming healthy cells. If this treatment is already recognized by the US medical community, it's strange it's not prescribed more often. The next one is natural killer cells. This one is perhaps the biggest weapon in your arsenal against cancer. Natural killer cells are special immune cells that have been specifically trained to hunt down only one type of cell. That's right, cancer cells. Imagine millions of trained hitmen released in your bloodstream, hunting down only the bad guys. This is way better than other treatments, like injecting a toxic compound into your body that harms both good and bad cells. But how do you get rid of all the harmful antibodies and toxins in your blood? Plasmapheresis is a blood filtration treatment we use to remove harmful antibodies and toxins from your blood. This treatment is also approved in the US but not commonly used for cancer. While it's not typically a first option for some patients, we also offer pluripotent stem cell therapy using Dezawa Muse cells to help regulate your system and repair the damage caused in your body. Each dose contains millions of these cells that can generate healthy nerve and brain cells, muscle, bone, cartilage, and connective tissue, as well as lung, liver, and pancreas cells. And these Dezawa Muse cells are non-tumorigenic, meaning that they do not cause tumors to grow. And there are many more targeted and supportive treatments you can learn more about on our website. Ozone therapy, hyperbaric oxygen chamber, laetrile or amygdalin, herbal and mushroom therapies, glutathione enzyme therapies, immunoglobulin therapy, bioidentical hormone replacement therapy, nutritional protocols based on your DNA tests, and many more. Speaking of tests, the first thing we do is get extensive lab tests. We use CTC, which stands for Circulating Tumor Cells Test, that can detect cancer cells much earlier than traditional tests. The CTC technology is sadly not yet offered in the United States. But kudos to Australia for conducting a decisive study with over 500 patients to prove how well this test can detect cancer in its earliest stages. Why do we tell you all of this? Not to overwhelm you, but to remind you that you have options. You're not stuck between a rock and a hard place. Thousands of patients have come to us seeking a better outcome, and we help them achieve what seemed impossible, all without chemotherapy, radiation, or surgery. Visit our website to learn more and reach out to our team for a free virtual evaluation. No pressure, no commitment. Not only do you deserve to know your options, you deserve to have a say in how to treat your body. You deserve to turn the corner and live a healthy, vibrant life.